State health leaders say the Omicron variant has led to a rapid surge of new cases, setting a new record high for hospitalizations, with nearly 5,000 people hospitalized in Michigan. 13 on your side's Joshua Vincent breaks down what the MDHHS said this morning.
As the coronavirus pandemic continues, its impact here in Michigan is at a level that we haven't seen before, according to health officials. Locally here in West Michigan, Spectrum Health is reporting they currently have 374 people hospitalized, with less than a third of them, roughly 100 people, in the ICU. This virus is showing no mercy as it is impacting children across the state. 16 children are battling COVID currently at Helen DeVos Children's Hospital, and statewide, a little more than 100 kids are stricken with the virus. Michigan is currently seeing more than 129,000 cases per week, and the positivity rate is roughly 33%. Health officials addressing the reason why our numbers are so high, despite the fact so many people in the state are vaccinated. Take a listen.
So we know that the vaccines are phenomenal tools in protecting against severe illness and death. That doesn't mean that they will stop every single vaccinated individual from contracting COVID. What I can tell you is the people who are sickest with COVID, the people who are in ICUs and on ventilators, it's much more likely that they are either unvaccinated or unboosted.
Health officials are saying the roles of vaccines and boosters are important now more than ever as we're dealing with extremely high COVID numbers. And here at Spectrum Health, they are offering a fourth booster shot to those who are immunocompromised, as long as it has been at least 5 months or more since you've had your last shot. Reporting in Grand Rapids, Joshua Vincent, 13 on your side.
And the Omicron variant is also affecting our kids, especially those 5 and under. Helen DeVos Children's Hospital says they've seen more cases of croup associated with Omicron. Dr. Erica Michaels is a pediatric emergency physician with Helen DeVos, and she says Omicron attacks the upper respiratory system rather than the lungs. And since younger children have a much narrower airway, it doesn't take much inflammation to clog them.
It's a restriction to airflow that's happening high up in the windpipe, and it sounds like this. So when we're thinking about, do you need to come to the emergency department or not? It's really that noise and how much difficulty breathing your child's experiencing. If they're making that noise continuously and you can tell they're uncomfortable and struggling to breathe, please come downtown and see us. Come to the emergency department or go to your local emergency department. Croup is easily treated.
Symptoms of croup include runny nose, stuffy nose, that classic seal bark that she demonstrated, a hoarse voice, and mild fever. Dr. Michaels says if your child has Omicron-related croup, their symptoms could last up to 4 weeks. And the Omicron variant is also hitting college campuses hard. One day after classes restarted at Grand Valley State University, the school is reporting an additional 171 new COVID cases.
There are now 793 cases, and that is up from the 622 reported yesterday. Many of the cases are off campus, but students are still reporting to campus for in-person instruction. According to the university's dashboard, the positivity rate is just under 3%. The 7-day average of daily case reports is 106 new cases.